First, I apologize for not having video. My name is Matt Donovan. I'm the Assistant Director of Alumni Relations and Annual Giving for the Elliott School. I'm calling from West Virginia, where about an inch and a half of snow this morning has hampered my ability to connect to a strong Wi-Fi signal. So my apologies for that, but our two panelists today who will be doing the bulk of the speaking are able to join us by video, so we're grateful for that. So let me, before we dive into our conversation, just introduce our event series here a little bit. Let me first express to all those who are joining us, this is a community-wide call. So we have students, we have faculty, we have staff, we have alumni, and we have friends of the Elliott School and the greater GW population who've joined us today. And we're hoping that everybody is finding some peace and is safe and comfortable in what is an incredibly odd and trying and challenging time for the whole world. And really leads us into a unique position at the Elliott School to address many, many, many issues that we see arising right now in all corners of the world. So that is what we have formulated our Elliott Experts Weigh In series around. And throughout the next few weeks, we are going to have faculty and alumni speak to issues at hand and talk about regional responses and issue-based responses to coronavirus. So today we'll be starting with a look at Europe and European response in general to the coronavirus, as well as a little bit of a deeper dive into some of the countries that our two speakers have expertise on. Before introducing them, let me just make mention of the fact that you will be redirected when the call is over to a page listing our upcoming events. But just to preview them, we have alumna Diana B. Henriquez speaking about the markets in crisis and lessons from the past on an economic view on Wednesday, April 22nd. We'll have alumnus Jeff Lightfoot speaking to transatlantic challenges and opportunities made possible because of this crisis on Thursday, April 30th. And then we'll have Professor Maggie Chen speaking about the global economic system in the age of coronavirus on Thursday, May 7th. And it seems that all of these issues are changing by the day. I'm sure both of our faculty members today can speak to how Europe looks different day by day as we approach all of this. So with that, let me introduce them both briefly. We have Dr. Hope M. Harrison, who's an associate professor of history and international affairs. And as a brief intro, because I know we've shared their bios with you already, she's the recipient of fellowships from Fulbright, the Nobel Institute, the American Academy in Berlin, Harvard, and the Council on Foreign Relations, as well as the Woodrow Wilson International Center. And Dr. Harrison served on the staff of the National Security Council as the Director for European and Eurasian Affairs from 2000 to 2001. Dr. Kimberly Morgan is our current Director of the European and Eurasian Studies program at the Elliott School, as well as a Professor of Political Science and International Affairs. Her research focuses on the politics of social policy in the United States and Western Europe, with a particular interest in family policies, healthcare, and immigration. So with that, as a brief intro, I'm going to turn it over to both of our speakers, and perhaps Kimberly, we can start with you, as I'll let you both unmute yourselves, and we'll dive into an overview of what we've seen in Europe and from there.
Great. Thank you, Matt, and welcome to everybody. I think it's wonderful that you're organizing these events. I think a lot of people stuck at home, eager for some outlet and some dialogue and discussion, and perhaps want to get away from the sort of day-to-day of daily life and talk about some of these larger issues. So I'm happy to be here and try to contribute to that. So I thought what I would do is try to offer some comments about the responses to the COVID-19 crisis at both the domestic and EU level, the responses we've seen so far, and then offer some brief thoughts about larger implications. And this will necessarily be brief and rather superficial, and so I'll be happy to elaborate on points in the Q&A. So in terms of the immediate response to the crisis, I think what's been striking is how governments in Europe and virtually everywhere largely failed to grasp the seriousness of the new coronavirus in time to really do anything meaningful to stop it from ravaging their countries and their healthcare systems and their economies. So faced with a virus that spreads so efficiently and silently in the beginning, for which there's no vaccine and no cure, there's basically two options in terms of responses. One is extensive testing and contact tracing and then quarantining. And barring the ability to do that, then a lockdown, physically distancing people, locking down the entire country or regions within. Most countries did not respond in time to adopt either of these approaches, even as the spread of the virus was becoming apparent in Italy in late January and early February. And by the third week of February, the time by which already the alarm was being sounded by Italy, and was apparently the crisis was growing, countries still allowed their carnival celebrations to go on. The schools closed for the regular sort of winter break, during which many people take ski vacations and other types of vacations. Major events were not shut down. In fact, if anything, some governments encouraged people to keep going on with their daily lives, as Emmanuel Macron had done in France. And the result was continuing spread of the virus. So to give an example from France, one of these super was a gathering of an evangelical megachurch that held a week-long event in Mulhouse in eastern France in mid-February. And somebody had the virus there, at least one person. And since then, some 2,500 cases have been traced back to that one moment, that 1 week-long event, as people took the virus with them all over France, all over Europe, and indeed all over the world from that one meeting. So, but then, once it became apparent that countries had not responded quickly enough, the virus started to take its toll on individuals, on the economy, and of course on healthcare systems, revealing that even in these very rich countries with their universal healthcare systems, that they would struggle to cope with a pandemic of this kind. So a few countries were exceptions in that they did respond fairly quickly. Germany responded early on with the testing and tracing approach, which I think Hope is going to talk about in more detail. Portugal is one of the few countries that has actually bent the curve of infections early on, and it did so by shutting down the country fairly quickly after learning about cases in the country. Sweden is also an exception in the sense that while virtually every other country in Europe has really imposed national lockdowns, Sweden has not imposed a nationwide lockdown. It's closed some schools, but not all. It's banned gatherings of people, of more than 50 people, but not shut down restaurants and bars. It's encouraged people to voluntarily social distance, but not actually tried to enforce that kind of restriction. And basically, the people there have tried to argue that it's better to find a way to manage this disease, have enough people be exposed to it, try to manage it with the existing healthcare system, and trust people to make good decisions about social distancing. It should be said, however, that there's continuing debate about whether or not this was actually a good decision. Debate in Sweden, critics in Sweden say this was not a good move. Critics from outside of Sweden, and certainly per capita deaths in Sweden are now higher than in any of its Nordic neighbors, and higher than in Germany, although still lower than in countries like France or Spain or Italy. So in addition to the individual governments not responding quickly enough, the EU also did not mobilize early enough. At the EU level, there were certainly discussions about the issue, but no effort to really sound the alarm. Of course, healthcare is a domestic matter. It's within the EU's competence, but nonetheless, there are ways in which the various institutions at the EU level could have helped coordinate responses, share information, and simply draw attention to the seriousness of the issue. And in essence, the EU didn't really start acting, or its various entities did not start acting until early in March, when much of the spread had already taken place. So in general, looking at the government responses, I think what we see in common is that most governments responded too little and too late, followed by a very panicked national shutdown that now countries are in the midst of. And I think there will be much written about this in the years ahead about why governments were so slow to respond. But I think many people would already observe that there was a certain level of complacency by governments and by experts in many countries as well. Complacency that came from the fact that previous epidemics, whether it's MERS or SARS in the early 2000s or the swine flu 2009, the Ebola crisis, all of those had managed to be contained locally. And so that people continued in Europe anyway to see these as problems somewhere else. Problems that, well, maybe we'd get a few cases, but we wouldn't see the kind of spread that had been experienced in other countries, in Asia or in Africa, for instance. And so there was a lot of complacency that this would be a similar situation. Now we're faced with the consequences, both economic and political, and here's where we get into more speculative terrain about what the future could hold, both in the economic realm and in the political So in the economic sphere, I think we'll have some events here in the coming weeks that will better address this question than I can really talk about here. But I just want to highlight that I think Europe is going to be uniquely hard hit and is especially vulnerable to the kind of disruption that's been brought by this crisis. That Europe and European countries are deeply integrated in the global economy. A good deal of economic growth in Europe is highly dependent on trade and on tourism. So I myself had plans to be a tourist in Italy this summer to venture around northern Italy. My big, of course, obviously that's been canceled as it's been canceled for everybody else. And a country like Italy depends on tourism enormously. Some 61 million people a year visit Italy as tourists. And for France and Spain, it's more in the 80 to 90 million range. So for these countries, the clamping down on mobility, international mobility of people, of goods, and services is going to be hard to recover from. In terms of political ramifications, we can again sort of speculate. One of the immediate effects of the crisis has been to give a boost in political popularity for many leaders across Europe, including those who had not been doing particularly well, like Boris Johnson in the UK, or someone like Angela Merkel, who's gotten a real boost in approval ratings in the last weeks, as I'm sure Hope will talk about. Somebody like French President Emmanuel Macron. Well, his disapproval ratings still are higher than his approval ratings, but they're less grim for him than was the case in the past. His approval ratings have gone up, his disapproval ratings have gone down somewhat. And in a country like Italy, Giuseppe Conte, the prime minister there, has seen a major rise in popularity, even as this country has been so hard hit. But how long will this last? I'd say it's very doubtful that the goodwill felt by the public towards their leaders will continue, given the magnitude of the economic and political challenges that lie ahead. Already, I think we can see as the public becomes aware of flaws in the responses by their governments, there's been a negative response. So to take the case of France, Emmanuel Macron, if you look at his approval ratings or his disapproval ratings, in a sense, he's already flattened his own curve in terms of approval ratings. The bump that he got in approval has already leveled off. And if anything, it's starting to deteriorate again as people become aware of various missteps that government, that he took and his government took in response to the crisis. Could the populist right ultimately benefit from this situation? I would say absolutely. There's been a lot of discussion about this already, with some people speculating that perhaps the populist right will decline in its support will decline as people sort of turn back to government again and hope that government can help with the kinds of crises that people are in, and the sort of faith is restored in mainstream politics. But I would say not so fast. I think the populist right historically has always thrived on situations of economic turmoil and despair. And given that we are now entering into what may be the worst crisis that we faced since the Great Depression, I think we have a lot of ahead of us in terms of the way in which the populist right could really benefit from the situation. At the EU level, I'll just say very briefly what's been startling about the European response and the threats to the EU as a consequence of that is the lack of unity in response to this crisis. That initial discussions about how to help Italy and other Southern European countries who were ravaged by the virus basically put on display the lack of solidarity and collective will in the European Union. The North-South divide, for instance, over the question of whether or not to issue something like Corona bonds that would be backed by all the governments in the EU so that they could raise a good amount of revenue at lower costs. Well, the northern economies, especially Germany and the Netherlands, took a pretty strident stand in opposition to this, with the Dutch finance minister saying, I am not okay with this and will never be okay with this. And so it was a sign of the kind of divide that has been in Europe for a very long time, that came to the forefront with the last financial crisis and again with the migration crisis. And here we see it again with an arguably even greater set of challenges facing the European Union. So it's worrisome about the future for the European Union as well. Certainly, they did manage to pass a rescue package last week that has a good amount of money in it, but we're really just at the beginning of dealing with the reverberations of this crisis. So I guess for the European Union as well, I would strike a rather pessimistic note about its capacity for unity both now and in the months to come. that, I'll stop and turn the microphone over to Hope.
All right, Kimberly, it's great to do this with you, and hello to everyone. It's wonderful to be here. Thank you particularly for Matt for putting this together. You know, all of us at the Elliott School are working very closely with our students to try to help them get through this. I'm sure those who are alumni who are on this call are finding it hard to imagine what would their time at the Elliott School have been like if they weren't in person with their classmates and their professors. You know, we're lucky we had over half the semester before we were forced to go online. So we had established a rapport with our students that, you know, could somewhat keep up online. And I'll tell you, I've been very happy to see my students pop up on my computer screen when we have class each week. So I'm going to talk about Germany and the coronavirus, COVID-19. When things were getting started as this virus was spreading in March, I was in fact supposed to be going to Germany for a 2-week book tour sponsored by the US Embassy in Berlin. I canceled that when it seemed the way things were going, and I'm glad I did. I was supposed to be back there in May. I'm supposed to be back there in August. I'm supposed to be back there for talks in October. And, you know, I have no idea when I will be getting back to Germany. But I've been following it closely from afar, and also talking to friends there about what the situation is. Let me say that just sort of right before this began, the German government had a meeting about future measures. Germany started their social distancing measures on March 23rd, which was after France, Austria, and a couple of others. So they were a little bit late initially. And their social distancing measures were supposed to be generally over next Monday, which is the day after spring school holidays are over. So the chancellor and the governors of all the German states just had a video conference today in which they decided to extend the social distancing measures until at least May 3rd. They are putting a ban on all large events through August 31st right now. But they're going to allow starting next week gradually, and it remains to be seen exactly how this is going to happen, some small shops to reopen. And that beginning after May 4th, some schools will gradually reopen. They don't require face masks, but they say that they are urgently recommending people wear face masks when they're out. They're ramping up the number of healthcare workers available at the front lines. They're bringing in the Bundeswehr. So they're doing everything they can to keep monitoring and to keep monitoring this, and wanting, of course, to prevent, as we all do, sort of a whole new round of it by opening things up too quickly. Now, Germany is a federal system, just like here in the US, and of course the EU itself. And so guidelines that come out from the top, from the chancellor, are guidelines, which the governors all agreed with her today on those. But there are sometimes some differences from state to state. I mean, Germany stopped people from traveling between states. Bavaria has been out ahead in terms of quite restrictive measures for which the governor, Söder, has very strong approval ratings throughout the country for his restrictive measures. Whereas the governor of North Rhine-Westphalia keeps pushing to reopen things sort of sooner than others want to. So, you know, there are differences at the state level. COVID-19 started in Germany with a worker at a car parts factory in Munich. The worker came from China, employed by that company, came for a seminar. Well, that person was carrying it. She fell ill on her way back from China. She tested positive when she got back to China. And she immediately told her bosses in Munich, who then started working very closely with medical sort of authorities. Their equivalent of the CDC, the Center for Disease Control, is the Robert Koch Institute. They worked very closely with them to start tracing exactly who this person had come into contact with. They used a lot of electronic calendars, which could very quickly tell them, for people who had put meetings into their electronic calendars, who had met with her. And they came to call this group the Munich cluster, and got started on that quickly. Chancellor Merkel, who herself, her background is as a physicist. Her personality is very sort of straight and calm, has had a very kind of, as much as is possible, soothing effect on the country because she is trusted. And many people have also talked about the fact that she herself grew up in the former East Germany, and that has also helped her cope with this, because people in East Germany, first of all, communist East Germany, were used to some difficult circumstances and some restrictions on their freedoms, even if they didn't like it. But even more, people from East Germany experienced such a rupture in their world with the fall of the wall and then German unification 30 years ago in 1990, which left large numbers of East Germans unemployed, searching for their way forward in this new system. And interestingly, in the largest circulation newspaper in Germany, Die Welt, which means the world, one of the opinion editorials in Die Welt, which is generally center-right, which is also her own party, but they said, you know what, we're lucky that the Chancellor of Germany right now is from the former East, because she has skills that maybe some people from the West, who never had their whole world turned upside down, she's had to develop these skills. So that's, there's been some discussion of that. Germany has a very strong healthcare system, and in fact, has, I think, the largest sort of per capita number of intensive care hospital beds. So in fact, sick people from other EU countries are being sent in some cases to Germany, because they have the capacity and also the know-how. On the economy, of course, like everyone else, the economy has been thrown into a tailspin. car manufacturers, one of the really strong parts of the German economy, their whole supply chain has been interrupted. Their workers are getting sick. And of course, it was in a car parts factory that the first COVID-19 case occurred in Germany. But Germany has a weapon that a lot of other countries don't have. And in fact, this weapon helped them get through the 2008 financial crisis. And namely, it's this kind of this program called Kurzarbeit, short work. It means working for fewer hours. So it means that when your company is facing financial difficulties, one way to handle that is to allow workers to work fewer hours and then to register with the government for government funds to in fact pay the salaries of all these workers who are working fewer hours. So it means that you don't furlough these workers and you certainly don't fire them. They're still there working fewer hours, but it means that hopefully when, not if, when your company gets through the crisis, they're still there, and the training you've invested in them, their know-how is still there, and then they can come back and keep working. So there's a massive, Germany already had a lot of money in this fund, and they have now put even more money into this fund. Also on the economy, the issue of harvesting things that food in the spring, such as a favorite of many Germans and of myself, their famous white asparagus, Spargel. Well, they bring in tens of thousands of foreign workers each year to do this. And so the government has agreed to charter flights of people from Romania and from Poland, tens of thousands, I think up to 80,000 people for April and May, to get the asparagus out of the ground so it doesn't go bad, and to get the strawberries so they don't go bad. But there were all these stories, for example, in Romania at the airport in Cluj, there was absolutely no social distancing, and there were these thousands of workers waiting to get on the planes, all packed in together. So once they arrive in Germany, they will all be tested and maybe even in quarantine for a period. Supposedly, well, many of them already are in Germany to help with this spring harvest. On the measures to keep people separate from each other, no more than 2 people together, including driving in a car. There have been some crazy, perhaps stereotypical stories that have appeared on the front pages of German newspapers lately, namely with German neighbors reporting on each other for not abiding by these rules and saying, I saw this group of people in the courtyard of our building and they don't live here, and they were with this neighbor. So people who lived through the East German past with the ubiquitous secret police for whom many ordinary citizens signed on as informers, there are a lot of people very uncomfortable and very upset that this, informer tendency is happening. The police, in fact, had to ask Germans to stop calling the equivalent of 911, their emergency number, to report on people violating the social distance regulations. There has been police surveillance of various areas. They had a Zeppelin flying over the Bodensee in the south, on the border between Germany and Switzerland, over the weekends when it was nice weather and they, people weren't supposed to be all together. They've got helicopters flying over other places. They've got policemen walking around, police on horses, going through some of the parks in Berlin, telling people to separate. So there is an increasing discussion in Germany, which has been going on now for quite a while, of the trade-offs between liberty and privacy, or in this case, maybe health and privacy. And one of the ways this is coming up is also this talk about some sort of app, a cell phone app, where you could see sort of where people with the virus are in your vicinity to stay away from them. On the subject of digital aspects of this, like the US, Germans have been trying to go to school online, but internet access and broadband access, the infrastructure for that is not so great in Germany. Germany is way ahead of many countries in so many ways economically, but not in terms of access, in terms of broadband internet access. It has in fact been a real problem. And in an EU survey of the capacity for digital learning in countries across the EU, Germany, in fact, came in at the bottom. So they're also now investing in their emergency funds to deal with COVID-19 with ramping up that capacity. Germany in July will take over the 6-month rotating presidency of the EU, and Foreign Minister Heiko Maas has said, it will be a Corona presidency. That will obviously be the focus of what Germany does when leading the EU. So let me turn finally to a couple remarks about politics and sort of the impact right now on how things are playing out politically. Well, as Kimberly mentioned, Chancellor Angela Merkel and her party and the ruling government, the CDU, Christian Democratic Union, grand coalition with the Social Democratic Party, the SPD, Merkel and the governing coalition are getting very high approval rates. 88% of Germans approve of the government's handling of the crisis, and 80% of those approve of Merkel's handling specifically. In polls that say, how would you vote if elections were held this week? The CDU, Merkel's party, is far ahead. It's at 36%. Everyone else is way behind. The SPD is at about 17%, the Greens at about 16%. The far right, AfD, is at 9 to 10%, the left at 8%, and the FDP at 5%. With regard to the popularity of individual politicians, Merkel is rated the first, the most popular. The minister president of Bavaria, Söder, comes in second. The finance minister Schulz of the SPD is coming in third, and the health minister Jens Spahn, who is also in Merkel's party, is coming in fourth. Now, you may be aware that 2 years ago, Angela Merkel announced she would not be running to be chancellor for a 5th time next year in 2021, that she would step aside. A lot of people, at least right now, wish she would change her mind and run again, because she's certainly is the most popular. But in terms of who should run for the party, the CDU, instead of her, the most popular, again, is the Minister President of Bavaria, Söder. The second most popular is Merz, who was doing much better before this crisis, but hasn't been so visible in the crisis. Followed by the Minister President of North Rhine-Westphalia, Laschet, and a couple of others. So two final points. On the far right, the AFD, which Kimberly mentioned a bit. So the far right, which had been growing in popularity, of course, has been quieted by this for now. They also are in agreement with some of the government's policies, such as, of course, they were very happy when the government closed the borders of Germany, which the far right had wanted to do for, asylum seekers and refugees anyway. The AFD was also very happy that the government did not support the Corona bonds possibility in the EU. The AFD itself was founded in 2013 in the wake of the Euro bonds crisis, basically saying, we have enough to do in Germany. We are still investing in bringing up the eastern part of the country. We don't want to help others. We just want to help ourselves. And that remains, how the majority of Germans feel right now. So the sense that, they're going to come to agreements on big ways of helping some of the other countries in Europe, that doesn't look so good. So I guess actually I will leave it there so we can open it up for questions. Thank you.
Great. Thank you to you both for those. And I think the first question, I'll try to build on, Hope, what you've closed with there and looking at the AFD and the right. In general, do you think that the economic fallout from this, especially as this continues, should it continue through the summer and well into the fall, will that further fuel the rise of populists, both in countries like Germany? Will they grow stronger over time as the economic situation changes? And then, Kimberly, do we think that that effect could be seen across the whole of the European project?
Well, AFD supporters have tended to come from people who were doing fairly well economically at the time, but who feared their economic future didn't look so good. So, there's certainly a heck of a lot more people now who have fears about their economic future. So that certainly could, would give further support to the AFD. But, the AFD hasn't been able to come up with, any sort of different way of handling this crisis. This isn't really, it's much less a political decision than a decision for medical professionals and professionals in infectious diseases. And, so far, Merkel's government is working very closely with them. And of course, the AFD voters, as well as everyone else, is dependent upon all the measures the government is putting in place to offer economic aid, such as that shorter work hour sort of aid available from the government. So I think it's mixed in Germany on how this may help or hinder the rise of the far right?
Yeah, I would say, similar to what Hope has described with the off day in Germany, that in other countries as well, in many ways, the radical right or the populist right has actually had a relatively low profile so far. I think because of the immediate nature of the crisis, and it's much more about the experts, the medical personnel, and the boost in popularity of mainstream politicians, and so it's not really a moment for them to be politicizing issues. But they've certainly laid the groundwork for politicizing many of the things that are going to come to the forefront as the immediate crisis recedes. The kind of difficult economic circumstances that many people are going to be in, the tough economic policy decisions. And I think especially the EU questions are going to be especially sort of low-hanging fruit. We already can see this in Italy with Matteo Salvini, the leader of the Lega, the League. He is just waiting for the opportunity to put on the agenda again the question of, should Italy get out of the EU? Should it get out of the euro? He's already making lots of noises about this. It's just not at the front of people's minds at the moment as they're trying to get through the crisis. But the more we see this lack of solidarity on the part of other countries towards Italy, that's definitely fueled the discussions in Italy. Well, why are we part of this union anyway? And that's the kind of thing that the populist right stands by to exploit.
Great. And do you think, building on that, is there a general sense maybe that the trend this is instilling maybe to be driving countries further apart, and that those who are already skeptical might be further feeling that? Or do you think it's going to be case by case as countries such as Italy see such a greater hardship than certain others within the Union?
Are you referring to the future of the European Union? Is that what you're asking about?
I could put it in broad terms just like that.
Yeah, really hard to say now, isn't it? I have to say, having watched the European Union and its member states' responses to the last two major crises, the financial crisis that started in 2008 and the migration crisis, I think in both instances, the Union, in my opinion, did not exit those crises or emerge from those crises strengthened. I think countries and the European Union as a whole muddled through, got to the other side of these crises, but I wouldn't say that the union itself was strengthened. If anything, what I would say is that each crisis revealed divisions between member states that are very hard to paper over. And this crisis is so much more severe that it makes me fairly pessimistic. It's not that I think the European Union is going to end. I think European integration, the nature of it, the shape of it could change. The euro, I think, is going to be very much threatened. Will all the existing countries in the euro stay in the euro? I'm not an economist. It's not my area of expertise, but I'm certainly doubtful about the prospects. Whether or not states are actually going to want to leave the EU is another matter. I think the British experience showed a lot of them that it's not such an easy thing to get out of the EU, nor desirable, but the shape of European integration, the nature of cooperation could be affected, I think, in ways that would move away from cooperation.
Great, thanks. And then Hope touched on, it sounds like perhaps North Rhine-Westphalia is doing its best Florida impression at this point in time, or may look similar to that. So perhaps both, starting with Hope on the micro level inside of Germany, and then Kimberly looking at Europe as a whole, do we see a broader sense of coalition governments, especially, feeling the need to work closer together? Or do we think that the traditional lines where folks have argued have really remained similar? I hope you touched a little bit on this earlier, where saying that inherently people are people and we all have to get through this together. But I guess, do you see new lines emerging between others, or do you think that sort of the traditional divisions perhaps remain as both countries and regions try to respond to this?
Well, obviously this is such an incredibly challenging situation, because on the one hand, for Germany, for the US, for the EU, for everyone, there has to be cooperation. I mean, if only some people are social distancing and others aren't, we're not going to get rid of the virus. Not in a community, not in a state, not in a country, not on a continent. So, in Germany, in terms of the federal level versus the state levels, everyone is realizing that, there absolutely has to be some cooperation. But every person feels sort of the economic and perhaps coming from the political pressures. We hear that in the US as well, obviously. It's this push between what's good for the economy and what's good for people's health, and finding that right balance. How to find that right balance is definitely, the $64 million question, or million euro question these days, or trillion. And I think, therefore, it's a moving target. I mean, the second some things start loosening, some restrictions start loosening, there are always going to be some people who push the further limits, whether it be with their own store and how many people they actually let into that store because they want to sell more, because they need to make more money to take it home to their family. And, you magnify that, in each state, in each country. And, these are challenging times. And Austria, I think yesterday, Austria opened up some shops and some businesses, and a couple of other European countries are starting to do that. And I think, just as we all learned from China at the beginning, I think, everybody's going to be watching what happens in each of these countries as they start, some gradual reduction in the social distancing regulations. What happens? Do the numbers of people testing positive spike again? This is going to be with us, obviously, for a while. And I really can only second what Kimberly said on the question of the EU. When I just look at the German approach to the EU, there are really two sides of this. I mean, people from certainly particularly older generations, including Angela Merkel's, feel absolutely the historical importance of the EU because of World War II. The sense that countries need to cooperate. And in this day and age, when we see, what disease can do, what radiation can do, global warming, we're in it together. And so on the one hand, certainly someone like Angela Merkel is incredibly committed to not giving up on the European project. But on the other hand, also wants to be selfish, and, the benefits that Germany has from their economy and their system, wanting to keep that, for Germans, as opposed to helping lots of Italians. So it's really, I think, a split view from Germany.
Just add to that I think one of the things that we'll see is, unfolding in the months ahead, is the fact that countries really were differentially affected by the virus itself. And so, some of the countries like Denmark that managed to close up fairly early certainly had a number of cases, but now they're starting to open up again their economy. Sweden has never fully shut down its economy. Austria is opening up again, but a lot of Central and Eastern European countries managed to close up things quick enough, it seems, so far anyway, so they don't have as many cases. So the impact on countries is highly variable, and they're likely to bring that with them to the table as they talk about sort of how much solidarity, pan-European solidarity, they're willing to pay for, to help other countries. So I think that just adds another wrinkle to the question of cooperation, that, Spain, Italy were the ones that really got hit. France hit very, very hard. The UK also now hit pretty hard, although they're off, they're out of the EU. But, how much is Sweden going to want to contribute? How much is, I know somebody asked a question about Latvia in the chat here, which is a country that has very few cases. How much are they going to want to contribute to the efforts? How much are lots of countries in Central and Eastern Europe going to want to contribute? To the extent that they were not as affected by these things. So I think this just adds more complexity to this question of cooperation.
Great, thanks. So with time in mind here, I think I will ask a two-part closing question for each of you, which is a mouthful there. So perhaps we can start with you, Hope, and then with Kimberly. The first of the two parts being, what bright spots do you see right now? What is being done well? What can we point to and say this is positive in one way or another? And the second part being, what piece of advice would you offer for European leaders or technocrats as they're looking to respond? And that can be both on a micro level or a macro level, because I'm sure there's plenty of advice that everybody could go as we're learning here. I'll pose that to perhaps Hope first.
Wow, okay. Those are both challenging. But I guess in Germany, the bright spots are so far at least the strength of their system, the strength of their medical system, and the strength of their economic and political system. So, that they've got enough beds, they have well-qualified people, and also, I guess I would say, mostly, Germans are complying, sometimes over complying, in the sense that they're reporting on others, but obviously there are some others who aren't. But, overall, Germany is certainly poised to do better than a lot of other countries. Advice, well, obviously as a professor, I was fairly appalled when I saw the low level of digital capacity for learning in Germany. And, I'm glad that they're investing more in that. That's something that the people in the East have been complaining about, that, 30 years after German unification, there has been less access to broadband internet in the East than there is in the West. And so, hopefully that will now change. So, I guess we all, it's very difficult sometimes at an individual, at a national, a global level, to remember that, we're all in this together, and we need to look out not only for ourselves, but for each other.
Yeah, I would say on that note, that is one of the brighter spots, is that coming together feeling. I mean, you've really seen it in Italy and in the way people have come together, try to put aside political differences and show solidarity with each other, show support for the medical professionals. And I've been watching a lot of the videos of the things people have done to try to express their appreciation, the singing, the chanting, all those kinds of things just show the way a crisis like this can also bring out the best in people and bring out the best in the society. And so far, we've seen that in a lot of places that have been dealing with this, whether it's New York City or Northern Italy. In terms of advice, I mean, I think obviously governments around the world were caught off guard, but not all governments were caught off guard. You know, a lot of people talked early on about South Korea's very rapid response and how the kind of early action in terms of testing and isolation and shutdown made a huge difference there. And I would argue the reason they had that response is because they lived through the SARS crisis in the early 2000s and really experienced a serious pandemic already and knew the potential of this thing early on and had the right reflexes as a result. And like I said, I think in Europe, far removed from from SARS and from the swine flu, and thought that's somebody else's problem. You know, there weren't those kinds of reflexes in place. But I think now is an opportunity, given that we are in a world in which, you know, a highly globalized world, situation of global warming, various environmental challenges that we face in the future. I think now is the time for people to be thinking in advance about, well, what will the next crisis be, and what's the capacity? What kind of capacities do we need? Whether it's the digital investment, the hospital beds, or testing capacities, or other types of things. You know, and kind of trying to think outside the box in terms of not always fighting the last war, but what's the next one going to be? So, what would be the kinds of things we'd want to do to have resilience, so that, you know, faced with future crises, we'd be able to respond more effectively, whatever that crisis may be.
Great. Well, let me, just before closing here, thank you both very, very much for participating. This is our first session where we've had faculty speaking to a larger community about what really is a dynamic situation that looks different every single day and is continually developing. So I hope we'll be able to step back and perhaps reconvene in a month or a couple of months to see where we are at that point and look back on this conversation and reflect on it. But in the meantime, thank you both very, very much for joining us. It's really been insightful, and we've been glad to have you. So thank you for that. And to those who remain in the audience, just want to share again that our next event is going to be 1 week from today on April 22nd with alumna Diana B. Henriquez, who is a New York Times bestselling author. We'll be discussing the markets in crisis and lessons that we can draw from past crises as we look at all of this. With the hope that building on our conversation about Europe today, we can begin to weave a really global picture of what we're seeing and how we're reacting to that. So stay tuned for more. Thank you to those who've joined us today. And once again, thank you, Hope and Kimberly, very, very much for your time today.